everyone. My name is Dr. Kayla Kleeman, and I'm a licensed chiropractor at Thompson Healthcare and Sports Medicine. I've been with the company for the last 3 years, and although we do have 6 locations, I'm over in Bayville.
Hi, I'm Dr. Nicole, and I'm one of the acupuncturists here at the Lacey office. I've also been with the company for 3 years, and today we're going to be talking to you about stress management.
So in order to understand how to manage stress, I just want to talk to you guys about what stress is. One of the definitions of stress is that there are 3 different types. We have physical, we have mental, and we have emotional types of stresses. So what we would like to do is just kind of talk about how they manifest in our population.
But a lot of adults present stressors with like hypertension, high blood pressure, pain and tension in the body. There might be some insomnia. There might be some mood changes, depression. And if these things aren't addressed, they can develop into more serious conditions such as cardiovascular disease, some psychological disorders, and even metabolic syndrome. So today we're going to talk to you about how we can manage these stressors, with acupuncture and chiropractic, also some at-home exercises, and it really kind of boils down to, how everything's kind of connected through our central nervous system. So we'll get started with that.
So first and foremost, what we can be doing at home is something as simple as exercise. Now, I'm not saying you have to go and run 50 laps around the track. What we can do is take a nice walk. Just by doing a brisk 10-minute walk when you're feeling anxious or you're feeling stressed, actually will increase your mood for the next 45 minutes. So just by walking for that 10 minutes, it'll make you feel better for like the next hour, which is really, really cool.
It's becoming very popular now as meditation, and it doesn't need to be anything scary. You don't have to be doing it for an hour out of the day. You can do simple as like a 1-minute exercise. There's also, if you're a little bit nervous about starting with it, it took me a long time to be able to meditate. But I started out with simple guided meditations where it's almost like a visualization. Like it'd be talking to me and it'd be like, you're walking through the woods, you hear the trees rustle, and I was like, okay. And I'd say start small, and you might enjoy it, and you can increase it if you'd like, or you can stay with that 1-minute exercise a day.
Another thing that we can be doing is watching what we're eating. So eating healthy is essential to our body, not only because it's what the doctor says that you need to eat healthy, but actually because there is something as what is a good food and what's a bad food. And the reason that they're there is because the good foods are broken down in our body, and our body's actually able to use all those vitamins and minerals to revitalize and restore our bodies. So when we're eating a bunch of bad food or drinking a bunch of caffeine or fast food, our white breads, our pizzas, all the yummy stuff, our body actually, when it breaks it down, it has nothing to do with it. So they're like, what am I supposed to be doing with all this junk? And we'll actually start wreaking havoc and increasing the stress internally. So eating our leafy greens, our proteins, our all of the good stuff, then that's actually going to help benefit our body and decrease our stress levels at the same time.
Great, absolutely. Another easy thing to do, I think this is one of the easiest, is breathing, because we do it every day. There's 2 techniques that I really like to recommend to patients. One of them is where you bring the tip of your tongue and you put it to the roof of your mouth, like just where the teeth meet the roof of your mouth, and you hold it there. And you breathe in for 4 counts, then you hold for 7, and then you breathe out with sound for 8 counts, and kind of purse your lips, so it's like a whooshing sound. And what happens when you do this is that your heart rate lowers, your blood pressure lowers, and your mind calms. So it's really effective. And if you're like, oh, that's a little too long, a little too much, I can't remember all that, a really easy one that one of my meditation teachers taught me when I first started was, she's like, all right, if you need to start really slow, then when you breathe, you can breathe in for how many ever counts you want. It can just be 1 count in, 1 count out, or 2 counts in, 2 counts out. When you breathe in, think in your mind, let, and when you breathe out, think, go. And in about a matter of about 5-6 seconds, you start to feel like the chest stops to fall.
I bet.
And it's a really great way to decrease your blood pressure and to relax your mind.
Another thing that's really great with reducing stress is laughing. So there are tons of studies about how laughter is going to boost your entire mood, alter the way you're perceiving your day. It actually boosts your immune system. They found that laughing really hard, having a hearty laugh, like laughing till you cry or like keeling over because your stomach hurts from laughing.
Silent laugh. That's so funny that no sound comes out.
Right. That type of laughter actually will increase your mood, increase your immune system, and will have altered effects for up to 2 hours after that.
One of the other take-home things you can do, and this can be done pretty much anywhere, is a gratitude journal. And this is something that where it just kind of brings like positivity back into your life. So if you're having a bad day or you're a little bit stressed, or even if you're just a little bit sad too, if you think about the things that you are happy for and grateful for, you can either write them down, you can jot them down, in your phone, and you can reflect on those later, like when you are like, under like some stress, and just kind of reflecting on those gets you in a better state of mind. And then there's also some apps too that have like, you can journal in your apps. There's affirmations that are just like positive thoughts that you can read to like inspire you throughout the day.
So before we get into the actual chiropractic treatment for managing stress, I want to explain to you guys a little bit how stress can manifest in our body. So behind me is a diagram of the autonomic nervous system. What that is composed of is the brain, the entire spinal cord, and all of the nerves that feed from your spinal cord to everywhere in your body, every muscle, every organ, and regulates life constantly by doing constant feedback between the brain and wherever it needs to talk to, and then back to the brain again. Now, we have two branches of this constant communication. One is called our sympathetic nervous system, and basically that's our fight or flight. So if you're walking down the street and you see a big black bear chasing after you, your body is immediately going to go into fight or flight, and it's going to pump all the blood to your muscles. It's going to go to your eyes so you can see better, and you're going to be hightailing it down the street. That's your sympathetic. Our body is always stressed. We tend, as Americans, to live in a chronically higher stress state, meaning our body is always in fight or flight. So what will happen a lot of the times is this neurological response in our body will kick in. Anytime we're stressed, cortisol is going to be pumping through that body, and it's actually going to start feeding off of different muscles in the body that can provide it nutrition. Then what we'll feel are chronic trigger points that we can feel along our spine. I'm going to demonstrate on our patient here exactly what I'm referring to. So in order to find out exactly which type of stresses are affecting certain patients, I like to take a quick history on them. So we know our patient here, she has been experiencing 3.5 years of grad school, so tons of studying, a lot of anxiety. She was commuting an hour and a half to and from school each way. So we know that there are going to be some tight muscles in her upper back and traps. That's because a lot of the times that's where that cortisol likes to live and take the nutrients from certain muscles. So with our patient here today, we're going to test and see exactly which muscles are being affected, exactly which muscles may have that trigger point, and go from there. So with this, we're just going to do a muscle test. Now I'm going to go and just find some trigger points. Go ahead and try and hold it up for me. No way. Let's try another one. Hold it up here. Good. So the second I aggravate those tight muscle bundles, the whole arm will give out. So it's my job as a chiropractor to figure out exactly which ones, which we've identified. And now we're going to do some active release technique and some muscle work to go ahead and release that really tight muscle. So we've identified that her dorsal scapular nerve is being pinched with a bunch of muscles that live in this area. So I can actually feel this really uncomfortable muscle right here. So what we're going to do is a little active release technique to go ahead and release that muscle. So all you're going to do is bring this arm down, and you're going to look down. Perfect. And back up. And again. Perfect. Great. All right, now let's get you treated, and then I'm going to re-muscle test her and see if we made any clinical change. Now that we've identified that her C1, which is the very first vertebra in your neck, is a little bit out of alignment on the right, we're going to do a quick adjustment. So this guy here, you feel that? Mm-hmm. Yeah. So we're going to right here. Beautiful. All right, come on up for me. Now I'm going to aggravate that same area where all those muscles are kind of trapping that nerve. Hold it up again. Hold it up, 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 up. Awesome. So this shows me right away that the chiropractic treatment and the muscle work is really beneficial for her. And that's exactly where a lot of her chronic stress lies. We'll go ahead and go out in the back and we'll do some rapid release technology. We'll do some cold laser on her. She'll go see Dr. Nicole for some acupuncture. And in order to stabilize this, we might even throw her in for some physical therapy too. So it's pretty cool that we all work hand in hand. And this is something that is stress related. And this is exactly how we can help you guys. One of the great benefits to come into our office is we have something called rapid release. It's basically a high powerful doctor massager. What that means is it's going to break up a lot of the adhesions that are in this muscle, any fascial restrictions, any pain. It's rapidly going to release your pain. We also have a cold laser, which I'm going to show you guys. We have decompression tables. We have something called an ATM, which is great for low back and neck pain. We're going to do a little bit of a cold laser work. Now what this is going to do is it's going to bring an increased blood to this area, increase her circulation, and it actually promotes healing within at a quicker pace than the body can actually do for itself. We're one of the only clinics in Ocean County that utilize the cold laser. So now you've seen a little bit about how we can reduce stress and pain throughout the body on the chiropractic side of things. Let's go ahead and take it upstairs with Dr. Nicole and see exactly how acupuncture can help as well.
So Dr. Kayla mentioned how stress affects the parasympathetic and the sympathetic nervous system, and also mentioned how cortisol is involved by, it being tight muscles, like through the upper back and traps. Problem is that when your body stays in that fight or flight kind of stasis, and your glucose levels increase, which puts you at risk for diabetes, also weight gain, and cardiovascular disease. So what acupuncture can then do, as well as chiropractic, is help your body get back to an equilibrium and balance. So what's happening when the needles are in the body is it's regulating circulation of blood flow. And when the needles are in, we pick points that are along certain acupuncture meridians or channels. And these channels mirror neural pathways. No needles are going into nerves or anything like that. It's just stimulating movement along those pathways to create a reaction. And then I'm also going to take a look at her tongue. And when I'm looking at her tongue, I'm looking for the size of the tongue, the shape, the texture, if there's any markings, if there's moisture or no moisture, because this lets us know as acupuncturists what's going on internally in the body. Because even though she's coming in for maybe stress, maybe some pain, that might not be the root cause. So we want to find out what's actually causing the dysfunction and go from there. Instead of slapping a Band-Aid on it, we're going to treat, of course, the stress, but we want to find out what's causing that and treat that. So this kind of helps me lets me know what's internally going on in the body. So if you wouldn't mind, just go ahead and relax your jaw and stick out your tongue for me, please. Okay, great. And then go ahead underneath. Perfect. Thank you. So this point here that I'm starting off with is a point called Zusan Li, and it's actually a really great point for resetting the body's limbic and paralimbic system. And this is a system that helps your body's response to stress. I'm just doing a little stimulation here just to activate the point. And then this next pair of points I'm going to be doing, they're known as the 4 gates. And these points are basically like master points, and they help relax the body, they help decrease pain, and they also improve circulation. Okay, so these next points I'm doing here are Shen Men, sympathetic, and point 0. They're a combination of 3 of my favorite points. We used to call it Control-Alt-Delete because it resets your body's parasympathetic and sympathetic nervous system. So it will really get you back down into that parasympathetic where you can relax, take a nice nap. Once the needles are in, the patient lies here for about 30 minutes. There's a nice heated table. There's a heat lamp as well to keep everything nice and warm and comfortable. The needles are actually very, very thin. They're about the size of a hair. Most people don't even feel them going in, and they're really surprised that they can actually relax with needles in their body. It's very rare that someone comes in for acupuncture and doesn't have a response right away, whether that be a decrease in pain or a feeling of relaxation. And depending on the type of work environment, home life, and everyday stressors you have, really depends on how many times you need to come in for acupuncture. But this is something that we would work on with you during our initial intake and throughout the treatment plans.
We want to thank you guys so much for spending some time with us, learning a little bit about stress, how to manage that stress, and then kind of taking a peek into our lives and seeing how chiropractic can help reduce stress and how acupuncture can reduce stress. It's really cool because while we are working here on you individually, we're actually working as a giant team to manage your stress, to manage any issues that you have going on. So while you may think, oh, I never realized I could go to a chiropractor for stress, or I can go see an acupuncturist for stress, what you guys don't know is that everyone that comes through our doors, we have a meeting about you guys, and we're talking about you, and we're feeding off of each other, and we want to know, how is this person progressing? What's going on with them? How many times are you seeing them? Oh, have you tried this instead? We actually do this giant team approach where we work together with our physical therapists, with our nurse practitioners and our medical staff, with our massage therapists. And that's how it is here. We love it. All of our patients love coming in. They say how they feel like they're truly part of a family when they're here. And I know it's something that I'm super proud of being a part of. And I know Nicole,
absolutely,
right?
Yeah.
It's not really work. It's really, really fun. So we encourage you guys to take these tips into your own hands. And if you guys have any questions, feel free to come and see us.
Yeah.